Hello, everyone. I'd like to start with a short note about my work as a way of informing the audience of why I am speaking on the chosen topic. My work generally explores the conditions for legal effectiveness, is a technical term. In other words, why law works, why law fails. And a consistent theme at the heart of what I do across different areas of law is the role and impact of law on underserved equity-seeking groups, including Blacks, Indigenous, and other racialized folks and immigrants. In this presentation, what I hope to do is examine the impact of COVID-19 on women, more specifically on racialized women who find themselves at the front lines of the health and long-term care sectors. I ask why the pandemic has had a greater impact on them than any other population group, while examining the role of race and gender in generating this outcome. I will ask, as I like to describe it, the law question. And what is a law question? Simply, what is the role of law in producing these adverse outcomes? Okay, so a quick roadmap for my discussion today. I will begin with a general introduction and following that proceed to a discussion of the feminization of care work. Now, care work is often described as women's work. I will examine the impact on women of the ascription of gender roles in the healthcare and long-term care sectors in a time of COVID-19. Next, I will examine racism in the sector and how issues of race and immigration intersect to worsen health outcomes for women in the industry. The discussion is going to move next to the social context that further sustains the situation. And within this context, I will discuss social determinants of health. Following this, I will center law in this discussion, explaining the role of law in creating or sustaining the adverse outcomes that we've seen from long-term care homes. In my final analysis, I will introduce us to the concept of substantive legal effectiveness, SLE, explaining how the SLE concept eliminates and conceptualizes really many of the problems in the long-term care sector in Canada today. So let's start. It is now common knowledge that COVID has had a significant impact on women and racialized people. A common and indeed accurate explanation for this impact is the social context of the lives of those affected. Academics explain that context often through the terminology of social determinants of health. Now, the discussion of impact through the lens of social determinants of health sheds light on the broader impact of poverty as generated by socioeconomic and political factors on the health of individuals. In this conversation, the impact of law and legal processes, I always argue, is sort of a low rumbling sound that barely bubbles up to the surface of the discussion. And yet, law has a massive impact or massive implications for women's health. And so I ask, what then is the role of law in engendering the types of adverse outcomes that we have seen since the start of the pandemic? My hope is that before the end of this presentation, I'll focus carefully on long-term care industry as a case study and explain how law plays a greater role in engendering these outcomes than is often obvious. I want to continue now with some data on the impact of COVID-19 on women, especially racialized women in the caring industry. What does the evidence say? That women make up to 90% of staff working in long-term care homes, that up to 50% of caregivers in long-term care homes are immigrants, and as of November 2020, 75% of COVID deaths in Canada had occurred in long-term care homes. And we know that in a city like Toronto, where people of color make up half of the population of Toronto, they are counted for over 83% of COVID cases in that city. Okay, so the data, as well as an extensive review of the literature, would reveal that women and people of color are disproportionately impacted by COVID-19, and that the overrepresentation of women, particularly immigrant women, in long-term care homes is complicating this issue. And so in this, we see a clear recognition of the role of gender and race in the health outcomes we've seen since the pandemic in long-term care homes. The link between these factors and the social context of people's lives is arguably, some will say arguably self-evident. But I ask again, is the role of law apparent? It isn't always. And of course, there is no opening of the Pandora box on the role of law in women's lives without first engaging with gender and race. So I want to begin with gender. Okay, let's talk about the role of gender here. All right, so certain types of work have, as we all know, been historically labeled women's work. Home care, child care, all manners of caregiving. Therefore, it is no surprise that care work, even in the long-term care sector, is often regarded as women's work. In this description, care work, whether in the hospital setting or in nursing homes, is typically undervalued. Of course, there are benefits to this type of work for racialized and immigrant women. The ease of entry into the profession, the fact that immigration permits are often targeted to these jobs, and may I say, often low-paying jobs. But there are huge burdens in spite of the marginal benefits that there are. So there are economic challenges due to low pay, job loss, poor job mobility, lack of career advancement, as well as the health hazards from burnout, depression, and other workplace-related hazards. Now, for healthcare workers like healthcare staff like nurses, who have had to work on intense shift schedules during a period of increased demands on the healthcare system induced by COVID, they faced increased risk of developing chronic diseases such as cancers, mental health disorders, and obesity. And a 2021 study by Marisa Harrington affirms this point. And of course, we now know that women have higher rates of COVID-19 diagnosis and death. And one small way that we can understand the outcome is that there is simply a high ratio of women working frontline jobs. But like gender, race plays a prominent role as a determinant of health outcomes for women in the COVID era. The data shows that people of color are more likely to be low income, have less education, and have fewer job opportunities, all factors that lead many of them into the LTC sector, the long-term care sector. As I noted earlier, LTCs are accessible workplaces for racialized immigrants due to, of course, low entry barriers. But with few opportunities for career advancement, those who were forced into LTCs out of necessity often find themselves stuck in these professions. Migrant workers in Canada typically have their work permits tied to specific employers. They are often forced to withstand exploitation and poor working conditions. They are also less likely to complain formally or informally about work conditions for fear of losing their employment and the path to permanent residency. These problems were aggravated by COVID-19 as care workers were socially isolated often overworked, and were therefore at significantly higher risk of contracting COVID. Studies suggest that up to 1/3 of migrant workers who lost their jobs during the pandemic faced additional issues accessing federal income supports. You ask how so? The pandemic created long wait times for work permit renewal and PR approval. This in turn led to invalid social insurance numbers. And during the wait period, they were unable to access many federal supports, including health coverage and access to emergency benefits. The easy reasons for the disparities, again, one may argue, are on the surface. Persistently poor access to socioeconomic goods or to the social determinants of health that Caucasian neighbors and other economically stable Canadians can access. But I ask again, what is the role of law in this? Can we trace the footprints of law? And by which I mean, or I include rather, Black letter law, policies, programs, and practices in these problems? Well, before I get into the discussion of law properly, I want to turn now to a short discussion about social determinants of health. What are they? We know that they have been explained as the conditions and circumstances within which people are born, grow, live, and work, as influenced by political, economic, and social factors. And so with social determinants of health, we're looking at whether people have access to social goods, such as employment, healthcare, housing, to name a few. We now know that social determinants of health have had what has been described as a profound and uneven impact on COVID-19 morbidity and mortality. And of course, this can't be surprising given what we know about the experiences of low-income, racialized immigrant workers who work at the front lines. For example, that they have limited access to healthcare, they have poor living conditions, or often have employment without living wages, as well as that they lack adequate benefits or sick leave. So the picture that begins to emerge is that the intersections of race and gender and other social determinants, and other social determinants have implications for health and can produce very different health outcomes as between Caucasians and non-Caucasians. But social determinants of health do not exist in a vacuum. They are also not self-actuating. So a legitimate question is what forces shape social determinants of health. And while we may count many, a key undercurrent in all of the factors we can identify would be law. It is through law that governments provide social goods, administer benefits, control the behavior of citizens and non-citizens alike, define who is a citizen and who is not, circumscribe what social goods are available to one group or the other, and of course, advance group rights or not. And I could go on and on that. And indeed, a combination of unfair laws, policies, and poor governance over the life of this pandemic has worsened living conditions for racialized groups and worsened health outcomes. But think about this for one moment. While on the one hand, we attempt to use the tools of law to provide social goods and government benefits to ameliorate the impact of the pandemic, yet other legal frameworks, on the other hand, at the same time limit, circumscribe, and prohibit the satisfaction of those goals for many others in our communities. In addition, even legislation such as emergency program laws or laws governing the establishment and operation of long-term care homes, even legislation can be so limiting that we actually can trace the shocking impacts of the high death rate from COVID in nursing homes to such governing frameworks. And because laws have implications for women's health, and particularly for the health of the racialized woman, our laws must be attentive to issues of gender and race and other factors that I'm going to discuss very soon. In other words, what I'm saying is that there must be an intentionality in the way our laws are framed and administered. This intentionality in legislative design must be informed by the way in which laws are drafted and the way in which law impacts on those subjects to it. In other words, legislative design must be informed by the way law works. How does law work? It's a long story, but I will not bother you with a treatise on the procedural elements of law and how the process of creating law necessarily interferes with the objectives of a law. And rather, what I want to do is stay on course to examine the myriad factors beyond gender and race that shed light on the role of law in women's health and why law can have adverse outcomes for some and not others. And this brings me to the subject of legal effectiveness. Now, some of the factors, indeed, let's call them problems. Some of the problems inherent in law can be expressed through an intersectional framework, which captures the ways in which race, gender, class, and a host of other factors intersect against a backdrop of course, structural subordination and political and representational systems of power to create, as Crenshaw has expressed it, a unique and distinct forms of disadvantage for women of color. But beyond intersecting factors, beyond what we know about the way different factors can intersect to create unique disadvantages, beyond these intersecting factors, there are a host of home truths, elements of law, and norms that we must contend with in the life cycle of a law, factors that allow law to have the kind of impact it can have on women. We must confront the fact that the legal process is a lot more complicated, messier, if I may, than is revealed through a study of the intersections of identity categories and the structural inequalities underlying those categories. We must confront the vagaries of rule formulation, reception of a legal rule, the interpretation of the rule, and its application to real life subjects. We must confront the challenges with what I like to call declared legislative objectives. For example, a restrictive abortion law declaring that its purpose is to protect women. We must confront the fact that such declared objectives often have at their core the goal of limiting access to public goods that are critical for the health and well-being of women. We must face the fact that women of color are disproportionately affected by such legislative schemes. I would argue that a study of these factors, those messy factors, multitude of factors we've just seen in the last screen, I would argue that a study of these factors through the lens of effectiveness or impact studies is critical to a fulsome understanding of the role and limits of law in women's lives. The term effectiveness is employed to denote whether a law, a rule, or policy achieves the goal or objectives it was intended to achieve. This field of inquiry examines the conditions under which laws work or fail, and it is capable of teaching us a lot about the conditions under which law is best suited to foster equality and justice. And so in developing a new tool for understanding these myriad factors that worsen health outcomes, especially when we're looking at the experiences of racialized women, the goal is, or the goal was, to offer an approach that focuses on, number one, the looming role of law in complicating health outcomes. Two, in developing an approach that pulls all the messy myriad of factors or myriad factors that we just saw on the other screen, an approach that pulls all of those factors together into what is hopefully a coherent theory. And within that theory, introduce new and necessary connections between the factors. So basically, the overall goal to offer simple hypotheses of the conditions necessary for laws, policies, and systems to work well for all kinds of people, including racialized women. In laying out a new framework for understanding the effect of law, I suggest that certain considerations are critical to the effectiveness of law, of a piece of legislation, of a program, of systems of laws to manage, for example, a pandemic. These considerations have their foundations in ideas drawn from the very nature of law, itself very contexted, there is no one idea of what the nature of law is, of course, but basically from established ideas and contentions around what the nature of law is or ought to be. They are also drawn from ideas around law's uneasy relationship with and its aspiration towards, meeting the moral sensibilities and values of societal members. They are also drawn from law's ability to essentialize people, as well as from law's complex relationship with socially constructed identity groups. So that can be a lot to take in at first, but I explore all of that in my new book. And so you absolutely have to buy it and read it now. But basically, to return to the substantive legal effectiveness theory, what is the LCLE theory that I have developed from a consideration of all of these factors? It is one that is grounded on the notion that, like every living thing, a law works best under certain conditions. That is, when certain considerations are in place for its survival and effective functioning. And it is composed of three principled and conceptually related parts. So firstly, on objective subjects and the framing of law, the first tenet of the theory asks, does the framing, excuse me, thank you. Does the framing and the contents of a given system of rules or policies align with the actual objectives sought to be achieved by that law? And are those objectives and the content of the law reflective of the needs, identities, and social context of the subjects of the law, and how, these factors, needs, identities, and social context can worsen health outcomes? So when the stated objective of the law, I repeat an earlier point, is to protect women, and yet the impact of the law is a denial of access to abortion services, it means that there is a misalignment between the declared or stated objectives and the true latent objectives in the law. More specifically, it also means a misalignment between those stated objectives, which is to protect women's health, and the law's actual content and the effects of that content on everyday women. Think Texas. Now, how does the first tenet of the SLE theory map onto the problems in the long-term care sector that women face? In a moment. I return now to the parts of the theory. The second part of the theory, internal limits, ask, do the language and the social facts that are embodied in a law or the new norms it wants to establish, you know, mask wearing rules, social distancing, or whatever it is, do the language and social facts embodied in a law and the new norm it establishes allow for the fulfillment of those objectives, you know, when they are taken through the adjudicative or interpretive process, because a lot of damage happens to content once passed through that process. And finally, the third aspect of the theory asks whether the provisions of a given law reflect popular beliefs or the expectations of those affected by the law. And along those lines, what political or other values are embodied in the law, and what is their impact on citizens who will be affected by the law? Hoping that we have a rough idea of the constituent parts of the theory, let's see how the problems with the long-term care sector map onto the different parts of the theory. Let's begin. I ask again, first tenet of the rule, what are the objectives or goals of governors of the long-term care sector? Is the long-term care sector in Canada structured to meet those objectives or goals? Are the governing legislation framed to align with those goals? Does the framing of governors of Canada's LTC sector allow for the goals of equity, safe delivery of care to the vulnerable, especially when they are being delivered by an often marginalized and vulnerable workforce? So, is the system, including the legislation that is in place or that are in place, the policies, the practices, right? Is the system in totality designed to reflect the needs, identities, and social context of those who will be affected by the law? Think about needs. We have vulnerable elders in long-term care homes. Think about identities. We have racialized women and women from all backgrounds working in these institutions. And think about the social context, poverty, and the challenges for both the elders living there and the staff working there. Is the system of rules in place in Canada to govern long-term care homes? Is the system designed to reflect these factors? And so my answer on the first tenet or the first principle in SLE is that the answer here is no. No. The governance and framing of our long-term care sector and the accompanying laws fail on principle one. How so? Well, quickly, long-term care homes are excluded from Canada's Medicare system. Under the Medicare system, as established under Canada's the Canada Health Act, you know, for the federal government to make cash transfers to the provinces, they are known as Canada Health Transfers. Provinces must establish that their healthcare systems meet certain requirements, that it is public, it is comprehensive, it is universal, it is portable, and it is accessible. If long-term care homes are excluded from Medicare, it means the governors and the legislative frameworks across the provinces for long-term care homes are not held to these otherwise laudable standards set out under the Canada Health Act. The fact that provinces have control over long-term care governance has also led to a multitude of organizational structures and problems, such that what we have is a system that is fractured, that is poorly regulated, and that lacks proper oversight and consistency in quality standards. Still on principle one, another framing organizational problem may be evident in health outcomes as between privately and publicly owned LTCs. For-profit homes have seen a higher number of resident deaths and more extensive COVID-19 outbreaks. One wonders, really, why the choice of a private for-profit approach to governance, given that the products of that system do not always align with the goal of qualitative and equitable healthcare or care. One that caters to the interest of the women and the vulnerable seniors who live in these homes. The social context of women's lives, including and especially racialized women, and the social determinants of health at play make them overly represented in the death and adverse health outcomes resulting from this failure. Principle two. The second tenet of the theory of substantive legal effectiveness examines how elements that are inherent in law, that are internal to law, that are part of law, function as limits that adversely affect a law's impact. Language, the choice of words. Language, the social facts embodied in the content of a law, in its provisions, and the meanings ascribed to those provisions in the adjudicative or interpretive process. They all have implications for citizens. First, on principle number two, on law's internal limits, the theory recognizes that recognizes the importance of legal language, in the framing of rights and freedoms and entitlement. It recognizes that a lack of precision regarding how law should be applied to people and to whom it actually applies often manifests in procedural delays in whether people are able to access social benefits or healthcare benefits or not. It manifests in conscience-based objections to services that women need, abortion care and whatnot. It manifests in problems of interpretation and other administrative complications that deprive women of access to critical health services or expose them to discriminatory behavior. So when law pretends its subjects are without gender, the impact on women can be severe. So how does this aspect of the theory shed light on the challenges in the long-term care sector and women's experiences in the sector? Despite the fact that an overwhelming majority of long-term care workers are women and people of color, long-term care legislation in Canada is neutral on these facts. It references staff as if they are sexless beings without history, without context, and that this ignores important contextual factors which contribute to the overrepresentation of those groups in the profession, as well as their unique experiences as women. So when these genderless, decontextualized laws are paired with a system of rules already in place to limit the social goods available to resident non-members of our society, those whom I did say the US would refer to as aliens, and Canada would call a host of pretentiously benevolent pseudonyms, we begin to see how several pieces of legislation can work together to wreak havoc on certain groups. In this, the language and social facts, which we're looking at now on the principle two, shed light on how a lack of coherent framing of a law can derail its objectives, a subject we discuss on the principle one. And so finally, the language and framing of these laws suggests also a political focus on economic efficiency to the detriment of the health and safety of workers and residents. On principle theory, we have the external limits of law, under which the theory is attentive to how individuals respond to a law on the basis of a perceived moral quality in the law or a correctness of its provisions. Now, this part of the theory also allows for the analysis of how policies and legislation reflect political and other ideological beliefs, in a manner that can be problematic for society at large. And, how the concept of majority rule might allow for broader compliance with those policies, even as they harm society at large, even as they fail to meet the goals of justice and equity. And so the pandemic provides a near perfect testing ground for this part of the principle. An easy example is the difference in perspectives around mask wearing and other pandemic regulations, and how these differences have straddled all sorts of moral positions on my freedoms, on my rights versus your rights and your freedoms. And while we fight over this, lives are lost to the coronavirus because, of course, the signs and the pathways for infection, hospitalization, and death in and of themselves are immune to the virus of our politics. Another example of this tenet is evident in the differences in how well conservative versus liberal-leaning governments manage the pandemics based on their politics, more often than not, or more often than is normal or acceptable. Policies that are put in place to curb the pandemics and which worsen or ameliorate health outcomes of our LTC residents continue to be based on the political ideologies or values of the government in power rather than on science. We see the problems with such ideologies of personal rights, freedom above all else, in rising COVID case numbers. And a final point, since the enactment of the Canada Health Act, there have been significant cultural and societal changes which impact how senior care ought to be provided. Yet, despite the growing need for access to long-term care homes for our seniors, their designation as extended health services outside of Medicare has not been updated due arguably to the focus on economic efficiency and cost cutting, ideologies that are also linkable to a certain kind of political mindset. So conclusively, within this three-part framework, of particular relevance are the ways in which the outcomes of ineffective law end up doing greater harm to racialized women. Without oversimplifying what is by no means a simple subject, I got a lot of headache putting the theory together, so there's no way it is simple. Without oversimplifying this, I suggest that there is a missing intentionality in the crafting of laws and policies to combat the explanations of laws' ineffectiveness. Intentionality is even more important because law is defined by a certain tradition in its formulation and interpretation, one that assumes that law is always clear, always certain, always neutral and impartial. It isn't. And because law isn't inherently imbued with the characteristics of clarity, certainty, neutrality or impartiality, the theory of substantive legal effectiveness insists on a cohesive assessment that goes to the core of the complex reasons for the disparity in health outcomes between racialized and non-racialized peoples. It pulls together a seemingly distinct criteria into this three-part framework that offers a compound, but hopefully unified theory of law's effectiveness or ineffectiveness. It's been an absolute pleasure to share my research with you. Thank you for being here and thank you for listening.
Thank you so much. Is there any questions? I think we have a few minutes before our next speaker.
I was just wondering, how do you envision the language of a law that is actually responsive to gender and race? I'm just, trying to imagine this and I cannot, so.
Thank you, Anad, for your question. We are beginning to, or scholars in the area of women's rights are beginning to recognize the problems with legislative neutrality. When legislation is neutral on its face, that it pretends women don't exist, right? And it pretends that, the people who work in nursing homes are not predominantly women. And more often than not, like we saw in the statistics, racialized, marginalized women. It means that many of the problems that I have discussed in my presentation are not addressed. In the choice of language, in the framing of law, we can frame law in a way that actually acknowledges and responds to some of these challenges. Now, I know and understand that law cannot be so specific, right? There is also always an element of generality that should be as general as possible so as to cater to a number of issues. But I do believe that in the drafting and framing process of laws that govern LTCs, that governments can recognize that provisions can be put in place to address some of the challenges that this group of people face. It is not as simple as simply naming or identifying the women, because I'm sure there are men, of course, who work in these places as well. But it is in making provisions that allow attention to be paid to training of staff, the time provided for training, putting laws in place to prevent the turnover, the high turnovers that we have, that women were moving and staff were moving from place to place, and they do move from place to place to find work. And in that, infection spreads from one nursing home to another. Provisions can be put in place without necessarily naming or saying women. It should, but it can also be put in place in a way that recognizes the inherent problems that women face that men often don't, right, in the crafting of provisions. I hope that answers your question.
I don't know the law system in Canada very well. Are women in Canada protected against being fired because they are pregnant, for example? Is that something? Yeah.
They are by our human rights law, but at the same time, I am not the greatest optimist in terms of the way I share the critical lens on law, or cast a critical lens on law. I write about law's limits and the problems with law, such that I seem and I believe that you'll find more often that even though there is a law in the books that protects pregnant women, there's very little implementation of a law like that, because the legal process is not exactly user-friendly. It's not designed to simply allow us succeed in those kind of claims. I had an RA do research on that recently, and she was shocked as to how very little number of claims there were. And those that there were did not really succeed. The number of claims that succeeded was limited, and I was not surprised at all. I have experienced that kind of discrimination in my own workplace in the past, when I worked with the government of Canada, or the government of Alberta in Canada. And I experienced discrimination on grounds of pregnancy, but never felt that anything could come out of, enforcing or trying to have my rights enforced. So yes, the answer to your question is yes. Women are protected by law. In practice,
Yeah. Thank you very much for this insight.
You're welcome. My pleasure.
Thank you.